Hi, everybody. Welcome to this roundtable. My name is Rachel Chang, and I'm the Bloomberg News team leader for virus and consumer coverage at Bloomberg News in Asia. And, we're delighted to welcome you to this very exciting roundtable about the very important topic of preparing for the future, IoT, the Internet of Things, role in future health emergencies. So, we're obviously still in the midst of the worst public health crisis in the generation, and COVID-19 has changed the world we lived in. And in a socially distanced but digitally connected world, what we've seen is IoT has played a critical role in helping us gain a handle on the spread and management of COVID-19. So whether we're talking about contact tracing apps or the issues around privacy, or even further down the track, how do we maintain normal healthcare provision in a world where people need to be kept apart? Connectivity and the development of IoT has been an essential topic, both amongst government leaders and business leaders. So for me personally, I think when we started covering this pandemic, what really made this virus stand apart from previous issues, for example, the SARS pandemic in 2003, was really the role played by, what we call asymptomatic carriers, people who are infected but have no outward signs of disease. I think now we know that actually the proportion of these people is very high. One of the reasons why it was so difficult to get a handle on spread at the beginning of the pandemic. And this is where the role of contact tracing apps has really come in and emerged as an incredibly important tool for places to be able to keep a handle on where that spread is going, because you're not going to be able to see if somebody is sick just from somebody's infected just from the outward look. And we've seen some of the most successful governments, whether you talk about, for example, a place like Singapore, really lean into using these apps to contain COVID-19. At the same time, there's been very important discussions around privacy and how some of these technologies are going to be harnessed in the future. So, we're not going to introduce every speaker. If you're interested, please go to the website where every speaker has a bio. We do want to keep this session very conversational and free-flowing. And so I just want to start off by kicking it to Sheikh Thani, the Public Director of Health, to talk a little bit about what are some of the lessons that have been learned from the management of COVID-19 and how you were using IoT and some of these capabilities to contain the pandemic.
Yes, thank you, Rachel. Dear all, Assalamu alaikum wa rahmatullahi wa barakatuh. Regards from Qatar. This is Internet of Things has been very special for us in Qatar, as we can see through history. In 1920, when we have the great influenza that changed the world 100 years ago, and we thought this will not happen again. Exactly after 100 years, the human race was pushed again to go faster as they did in 1920. 1920 was they were in the labs and physics to get many vaccines, antibiotics, and new equipments like CT and MRI. And now we are asked as a humanity, as all growing community, with all this technology that we have, to push again for a better life. In this unprecedented times, and we are making history in COVID-19, how this happened, we were watching this time what's happening around the world and worried how this virus will come to us sooner or later. This communication through the world proven that the world should be working as one big ship in the space, and we need to work together in everything to save as much as we can lives and lower the pressure on healthcare system and assure confidence in the economy in the long term. So for this experience that we have seen, and everything was documented in the last 2 years, it was clear that some visionary people were saying that this will happen sooner or later and we should be ready. Some countries, as always, were more ready than other countries, but now we are working in solidarity. The always country leading will help the other countries. And we are hoping that this technology that started in many countries will be passed to other populations very soon. Example now, what the investment like Internet of Things was very clear, one of the most important things that we need to invest in. Qatar, we have this preparing for our World Cup 22, we were being prepared with emergencies, trying to invest in our technology and our internet. So in 2016, Qatar was one of the leading countries in the region on putting the internet in the 5G your country to help to enable the Internet of Things to go better. All the countries should start on 5G, as electricity was one reason before to make people poor richer. Now I think internet will enable all the world to have their chances, rich or poor, to get their chance to learn what they need and to protect themselves. So what happened in Qatar, we invested long time to have one system for our all public hospitals through a CERNER, and this helped us to have all the system together. Then we invested through Uridu and other Western companies for SAVES program, which is for surveillance and vaccine. And again, then we invested in doing more monitoring systems like Ihtiraz that help us, and more smart programs enter the information faster for everyone. And this helped us, Qatar, at least with this investment, that we never need to have a full lockdown like other countries. We have restrictions, yes, but the economy kept moving, especially in a country where we have more than 80% of the people coming from abroad for business, and we cannot stop this business on the long term. So we hope this thing that we learned, that especially working with universities in EMEA, this computing and grid, so cloud and grid computing, and these sensors that help us, dedicated programs for this, help us to keep the country with less challenges and mitigation, and ready to be recovered from this as soon as possible. Thank you.
Thank you. And, I think it's clear that the Qatar government did prioritize this very much and does manage from the government level a very seamless sort of application of some of these tools. I think one of the topics that I want to cover and open up to the rest of the speakers is, do we see this happening in a lot of different countries, or is it actually quite rare to have that high level coordination, and what are some of the challenges in putting that in place around the world?
Yes, as you can see, Qatar, we're lucky we prepared for the World Cup. Many countries still have political problems, shortage of cash, and they couldn't invest in this. This is an investment, but some countries needed to have loans to get this investment, and I think the international society will work to assure that this country is not left behind on this issue. When we started this investment, it was like a costly investment, but now everything we paid for is getting back to us, and trusting people that Qatar is ready for World Cup with this wise and balanced decision that we have taken. And our Qatar Airways was helping the world in traveling and moving things around the world, because the country decided that we need to have a part to help the world, and we can handle the risk from opening the airport on the long term. So this is the role that every country should keep adding their print for the world by proper preparation and seeing how this technology and these sensors can be spread to the world. The only challenge now that many companies are competing in the last 2 years to bring us a new technology and new sensors. Some of them are more effective than others, some are more efficient than others, and we are trying to evaluate which one to start practicing on and invest on more. And this is the chance of this type of forums to assure that all the world get to on their compass and go to the right direction.
Mm-hmm. Let's go to Mathias. I thank you.
Yeah, Rachel, to your question, I mean, last year has undoubtedly been a very difficult year for many people. I guess we all agree on this panel here, and healthcare systems around the world are finding themselves under increasing pressure. And the COVID-19 pandemic has, I would say, a wake-up call for the entire industry. On the one hand, COVID-19 has kind of revealed the shortcomings of the respective healthcare systems, and on the other hand, it keeps, I would say, acting as an accelerator for the implementation and adoption of innovation and digital transformation, right? Just very quickly, of course, our first priority last spring was to keep our employees safe and healthy, right? The field engineers installing and servicing urgently needed equipment to manufacturing workers, as we raised our production, and we increased global manufacturing to try to respond to the increased demand. Actually, we have, for example, quadrupled our capacity of ventilator production. And what's interesting, when we listen to hospital CEOs and we listen carefully, they tell us that they have progressed more in the last 10 to 12 months in their thinking about mobile and virtual health than they had expected to do so probably, I don't know, in the next 5 years or so. But also patients' attitudes are changing. Think of yourself. Patients don't necessarily want to go into a provider for a real physical visit if a virtual visit could work just as well, right? And as we see health systems starting to recover, I think patients still have some fear of going back into the hospital for care. And I think COVID-19 has in many ways made patients and clinicians more open to embracing new technologies that can help them work better and smarter. And this is the momentum moving forward that we have to use. And final remark, I think this is very important. It is strategy and not technology that drives clinical transformation. So it's not enough to buy a couple of apps and now you're a smart hospital. We are talking about a real change management process, a paradigm shift, I would say, that you need an entire organization to buy into. The clinicians, the IT department, the technical staff. People must be really committed. You need ambassadors, I would say, or change agents within the organization who are not only ready to get used to the new environment, but actively promote it internally. And I can tell you from a clinician's and radiologist's perspective, I'm a radiologist, all these efforts are only accepted if it doesn't get more complicated. The irony is that while this technology is initially designed, of course, to help productivity, it can actually add more work and complexity, right? So the best application, I would say, is the one that is almost invisible, that is seamlessly integrated into the workflow, unfolding the magic in the background.
Let's go to Lance. Do you have thoughts on that seamlessness and the challenges in making that happen?
Yeah, thanks, Rachel. And look, I have to echo Mathias's comments as well. I mean, from a Roche Diagnostics perspective, it was the same process internally within the organization. Keep people safe, then build a manufacturing capacity to do what we can for this world global challenge. And I think we've all been in the same space from a commercial perspective, if you like. What I'd like to throw into the mix here in terms of adoption of IoT and digital movement of information, if we think about it, I like to view this as a clash of dynamics, because on the one hand, healthcare, within the realms of healthcare, is a constant conversation about getting the right information to the right person at the right time, so as a clinician can make the relevant decision and treat that patient accordingly. That's not a new conversation within healthcare. Now, what COVID has forced upon us is that conversation to move out into the public space and in the form of adoption of track and trace apps and tools by which governments can help manage this pandemic. And it's almost a clash of a medical dialogue that's been going on for a long time that we haven't actually solved in a lot of areas, hitting a social environment where we are all very used to downloading apps on our phone and immediately using them and deploying them. And I think this is a fascinating conversation to have, because it's this interface between health dynamic and health information and the difference in uptake of an individual in a social setting versus the institutional uptake of digital platforms, IoT-based systems, etc., which is somewhat slower in the institutional adoption than it is in the public adoption. So for me, I think this is one of the fascinating elements that we're in at the moment, and we're all almost in a global clinical trial around this dynamic of the use of digital tools moving forward, and it has to be a collection of all willing parties to work together, make data interoperable, that will ultimately result in a meaningful outcome on this.
Mm-hmm. When you say institutional adoption is lagging, are you talking about hospitals, governments? Like, which institutions do we really need to put the focus on?
Look, historically, I would say, from my perspective, hospitals. Now, I would agree with Mathias's comments that in the last 18 months, that has accelerated significantly. I completely agree with that. But still, we have to go through an awful lot of processes and mechanics based on an old world to get adoption of digital tools to allow data to flow. And I think COVID has forced some issues on that and opened up some opportunities. Telehealth is a great one. Telehealth is being adopted during the course of COVID lockdowns. The question I would have is, do the funding mechanisms for certain hospitals and certain companies support telehealth existing in the future, or does simply the funding mechanism support going back into a face-to-face interaction with a clinician? So there's many other things that have to be in play for the lessons we've learned in COVID to actually take place and have a foothold and add value into the healthcare systems moving forward.
Interesting. Margareta, I think you wanted to jump in.
Yeah, I'm just hearing perspectives from people, and I thought I'll kind of wanting to share a provider perspective, right? I mean, we have heard from the manufacturers on what they're doing, but it's interesting that COVID, through kind of Fullerton Health, they are present in 9 markets in Asia Pacific and dealing with all the corporate requirements and patients' inquiries that we are receiving throughout this pandemic. It kind of actually shows us as well firsthand how the COVID-19 situation actually raises the new challenge, including unequal or lack of access to updated and accurate information and to quality of care. And I see that firsthand when that happened, because we are in the midst of all the vaccination in Australia, Philippines, Indonesia, as well as in Singapore. We are doing testing across all the 9 markets. And we're also doing tracing capabilities across borders. How do we bring in COVID-free, seafarers from Philippines to Singapore? So we are actually in the midst of all that. Perhaps something to share. The health-seeking behavior actually evolves throughout the region, and more people are turning to the internet for information. Unfortunately, that also provided a bit of a challenge because there are so many misinformation. And also access to reliable healthcare information. I think what we have done during this period is that we were able to execute one of our artificial intelligence-enabled system checker that was launched on the Fullerton Health Live Fuller mobile application platform. But what was evident through us was, even through the use of AI, we were able to minimize errors and enables faster decision making. But it's still there is still a lag in terms of when you have the symptoms and where care is actually available to you. So we try and connect the dots between the patient as well as some of the healthcare facilities. However, we still see major opportunities to see how AI can support self-help and also speed up that process flow to the right care that is nearest to the location of the patient. The other thing, maybe just to add on the tracing capabilities, and I know you're going to talk a little bit about the privacy part of that, was we were executing on bringing seafarers from Philippines to Singapore, being a hub of a port. It was also interesting to see the behaviors of when you put the wearables on the so-called the patients or the clients or the seafarers. We were using that to track their geolocation. We are also trying to get that to check their temperatures. We use telemedicine or telehealth to communicate with the seafarers to address some of the concerns that they have. But we do want to see, and we hope that the manufacturers are hearing, if they can provide solutions. We want to see a multi-purpose personal device that can monitor health stats a lot more accurately. That includes blood pressure, heart rate, sugar level, and hopefully we can transmit it via the telemedicine platform for better diagnosis and treatment. So that's really more of the provider space and perspective that we are sharing here.
Mm-hmm. Does anybody want to kind of jump in on that topic, or some of the groups that are being reached by these technologies now?
I think one thing I might add here, Rachel, maybe it's not a pure access to care question, but it's a place of care or a site of care. When we think about this transformation now, I heard a lot about change management and cultural thinking, and really this consumerization of how we think about healthcare. And as a company, as a manufacturer, traditionally we would think of just building a product for a physician to do a particular purpose and get a result. But what I'm seeing changing is this continuum of care and really thinking about that patient journey. So as Margareta mentioned, you know, what is that experience from start to finish? How do we weave it together so that it's easier for the common person to get access, that experience, that interaction with the physician? You know, we talk a lot about telemedicine, but in many cases, telemedicine is just a video call. How do you bring in the data at the right place so that that learning actually happens? I know as a patient, I've been to so many times, I've visited a physician, and then I'm left saying, I think I have 3 more questions, or where was that piece of paper? So we need to solve for that, those basic things that we assume happen on a day-to-day basis. And so for me, that transformation of that awareness and then solving that, whether it be you know, physician, whether it be hospital system, whether it be reimbursement strategies that really drive that right kind of outcomes, those are some of the things that I've really kind of reflected on. And I do think that some governments are taking a more active role in thinking through how do we reimburse differently. But that's a very challenging aspect because as was mentioned earlier, that change management piece usually means paying first before reward. And so when you change something, you're usually taking away in the short term. So I think from a Baxter standpoint, we've seen a large transformation of people wanting more home care. We have a large dialysis business. And so for people to be able to not have to go to a clinic, to be able to do their dialysis at home, and now remotely communicate not once a month, but daily with their physician about their actual progress on their therapy, it gives people more confidence to actually act on that. So those are some of the trends that I'm seeing on my side.
Mm-hmm. I mean, I'm interested to talk a bit about what are some of the bottlenecks and how do we kind of loosen those. I mean, Edwin, do you have any thoughts around that?
Yeah, so thanks, Rachel. And I think just to connect some of the points made by Mathias, Lance, and also Margareta to Andrew, right? I mean, if you look at some of this paradigm shift, it's definitely accelerated, you know, in the last 18 months or so. And it's not just, you know, a sole responsibility of any organizations. I think it requires a lot of collaborations across the board, even with the government, right? I mean, if you look at from a patient journey, right? I mean, in order for any countries, like what Sheikh Thani said, you know, avoid lockdowns, avoid any impacts to the economy. I think the first and foremost, we have to look at, you know, trying to cure, you know, any patients of this COVID-19 and also of some of the other diseases that may be happening across the world. And from a metadata perspective, if you look at some of the patient journey, I mean, if without the pandemic, everybody would be kind of converging at the sites, you know, and you would have to have some of these paper documents, getting yourself enrolled as a volunteer, and you know, going through the whole clinical trials, getting the investigational drug disbursed to you, having the doctors check up on you. So all this requires a lot of physical contact. But in this pandemic, all of a sudden, all these things are not possible, right? So with the Internet of Things that allows people to be still kind of remotely connected, we call it kind of decentralized trial, right? So the whole purpose of from a centralized to a decentralized trial, and again, depending on which, you know, the state of situation in each country, you know, for some countries, it may still be locked down. Some countries, you're still free to move around a little bit. And it's all possible, right? With technologies today, it's all possible. You can have a fully decentralized versus a kind of hybrid, you know, and for even a simple patient's registration as a volunteer, you know, if it can be done even remotely, you know, like what Andrew said, right? It's just not telemedicine, switching on the video, you know, the ability to address, you know, what am I going to see in this whole clinical trial? What am I going to experience? I think this will go a long way, you know, in improving the patient experience and also in retaining the patients. I mean, if you looked at some of the COVID-19 trials that have been ongoing, I mean, you talk about Moderna, right, which has used Medidata's platform, you know, from research all the way to the drug being made available, the vaccine being made available in less than a year. I mean, it's remarkable. In the traditional good old days, this would not have happened. But the fact that the Internet of Things having remote patients, tracking the results, getting the results through the regulations, government endorsing all the use of technology, accepting the data, accepting the quality, making sure that all audit process is in place. There's no risk to the patients. I think all these things are only made possible with the kind of technologies that we have today.
Yeah.
Yeah, definitely. Yeah, please go ahead.
Yes. So I will also share our best practice and the common practice from Microsoft perspective. So it's not about solution and products. I heard all the discussions happened, and we need to have another angle why we are implementing or why we are introducing the IoT. So we need to start from the business impact first. So from our perspective as a Microsoft, as a partner to all our organizations across Middle East and Africa, so we need to agree on what exactly the IoT makes sense. So maybe we'll go for the operation optimization, for example. Maybe we need to empower our health worker on the fields. Maybe we need to personalized or enable personalized care for our patient and citizen moving forward. Are we going to shift our direction after the reimagining states of the pandemics or COVID-19 to what we call it health and wellness? We started before, but now it is mandatory how we can scale out. Maybe we can go for a quality assurance, supply chain for vaccine management, how we can track asset tracking for the valuable assets. We have multiple operations, but we need to ask ourselves what exactly the reason of adapting the IoT. This is the first essential. From my Microsoft perspective, it's not about solution and a product, it's the foundations, how we can build together the foundations to adapt the maturity of the IoT. Most of the country, and it's going for connect and monitor. This is the first phase of the IoT maturity. So how we can assess our ability to connect and monitor the data coming from the sensor, coming from the devices. The second phase we need to move on. It is how we can analyze and improve the data we receive and take an action insights moving forward. After that, how we can transform these actions to artificial intelligence machine learning algorithm to be systematic later on. If we get this data, we got these actions, we got these insights, how we can do it systematically moving forward. And I need to highlight, for example, as an IoT, if we can connect to a back systems or an X-ray or MRI. So we have an algorithm with Microsoft partner. He's doing the chest analysis, how we can get the data, the DICOM format or the X-ray, and we can assess the progression of the virus on the chest and the lung, and how we can move forward. So the maturity level must be addressed. So connect and monitor, analyze, improve, and transform and expand. Also highlighting what exactly the product is. Not about one set or one solutions we need to move forward. As a Microsoft, we have a foundation and a platform. So starting from the cloud, all of us, we are in the journey of the cloud internet. After that, introducing what we call it IoT. So now Microsoft introducing what we call it IOMT, medical things. So how we can make something specifically if for our needs, for medical, for health. This is essential. It's not a general one because we are targeting a critical industry, and how we can move ahead to introduce IOMT, and also how we can introduce what we call it interoperability platform from the Azure Fire or the IoT Azure enabled, and how we can put the compliance and metrics on top of this platform. After that, we need to move ahead on the edge, because sometimes we have a device and how we can get all this data analyzed on the edge itself, like a camera sensor, maybe a chip for diabetics or something like that. After that, we need to move to the AI, and after that, digital twin, how we can simulate all that and create a replica of the physical things to be virtually, maybe it's a virtual care, maybe a telehealth, and so on. And also we need, the last one I need to highlight, I highlighted also the business impact we need to start with. Second is about a platform and foundations. And the last one, I need to highlight the challenge we face, how we can make self-critical for us to highlight what exactly the best cases and the common cases we have. And the challenge we have definitely, like Sheikh Mohammed, he did mention about the multiple solutions, multiple products on the markets, lack of knowledge, how we can build also a support and technical support for the platform and the foundation later on. Lack of budget and staff resources, and definitely about security. So this is exactly what I need to highlight from our side. It is about how we can move ahead on the impact side, definitely on the platform and foundations and the maturity assessments and the challenge we can face moving ahead.
I mean, I think that's a really good opportunity to talk a little bit about China. I think, Roberta, I know you want to talk about that experience that we saw in China, which is a place where, you know, so many people are mobile and they adopt new technologies so quickly. At the same time, your basic health provision is at a lower level and you don't see the same level of healthcare as in other places. I mean, what was your experience with seeing that digital transformation? What was essential in it?
Well, I think that one of the biggest proof statements about the pandemic, both being a driver and confirmer of the use of IoT and digital transformation for public health, has been how quickly China has been able to get a handle on the pandemic, and how quickly after the early outbreak, life got back to normal for China. And it was not but a matter of weeks when we started having the ability to use our mobile phone apps to check temperature, and for the government then to use it for contact tracing. And not long after that, we were able to report our COVID test results in a reliable way on our mobile phones. And then after that, our state of vaccination, that, you know, having who is vaccinated, who is not vaccinated. And I think that the consumer population, the government, and healthcare providers all recognize the amazing utility of that technology in helping the society get back to a normal state. As a provider, it was incredibly useful to us because it allowed us to keep both our staff, our healthcare workers, and our patients safe in a way that without that technology, I doubt we would have been able to. I recently got back from the United States after having spent most of the pandemic in China. And I was shocked that if you get vaccinated in the United States, you get a very flimsy little card that says the information handwritten about your vaccination. And it's totally unreliable. I mean, anybody could write out a card. And meanwhile, I got to proudly show my vaccination.
I think we may have lost a bit of connection with Roberta. But I mean, I think that is a good point, and it kind of brings me to one of the topics I did want to bring up, although we're quickly running out of time, which is this issue of privacy and how do we persuade really patients to come on board. At the same time, how do we protect them? Sheikh Thani, I don't know if you want to talk a little bit about this from the perspective of the Qatar government.
Yes, thank you, Rachel. It's important before we finish to see that all the challenge and how we're going to solve them. One of the challenges are resistance, security, and quality. So for resistance, that when you start new systems, the healthcare are already busy all the time, and they are not accepting to learn a lot for new things. And this can make risk their old system and the time they were collecting money or getting their goals achieved. So this is need to be spread for everyone, especially in countries like the challenge with Internet of Things. If you do it for private hospitals, it's not enough to cover the cost. But if you make it en masse, you can cover the cost fairly and get the value from it. But to make it fully, you will have the resistance. And so you need to start the proper discussion and assure the resistance is low. Like vaccine is saving lives, but some people are resistant for it. This is regarding the resistance. Then security. When you make all the smartphones are connected to the basic central computer or programs in that, in the healthcare system, it at risk that you can get some viruses or some challenges that you keep hanging the system that can happen. Third thing is quality, that every time you start a system, you can't do it as all in the same quality. You need to accept some quality, some mistakes, without becoming, all the country know that there was some problems in the systems. These things, again, should be assured that we have been giving a good quality. And believe me, always, when we invest in these things, we see how we were living without them. But it's always a bridge or a wall we need to cross to go to our direction. And this should be aware of, and we should be brave and move forward as we need to go to the 21st century. Thank you.
Mm-hmm. And what more, or what should governments be doing to prepare themselves now and for future shocks? Mathias, I think you had some comments here.
Yeah, Rachel. I mean, Andrew and Edwin and Roberta mentioned the role of governments and other stakeholders. And I think we agree that no one company or government can solve this alone, which is why we are bringing together the ecosystem, like leveraging the strength of clinicians, technology partners, academics, startups, and so on. And I'd like to quickly talk about resilience, because the crisis has clearly shown, I'm from Germany, so I'm speaking a little bit about the EU now, that many EU member states, quite frankly, their healthcare systems are not sufficiently resilient against external shocks, right? Just as the pandemic. And most of the countries have submitted now national recovery plans. So each country now has to analyze if the crisis has shown that, for example, there is enough ICU infrastructure, if there is enough primary care facilities, and so on. And now I think it's a great opportunity, to have these funds available for national governments to really carefully analyze shortcomings in their healthcare systems, and then to think, what can we do to prevent future external shocks, to be more resilient? And I think resilient means, being able to look after every patient, pandemic or not. Therefore, the investments, I think, should be used in view of ensuring, like, cancer, cardiology, orthopedic patients, they continue to come. It's not like when there is the pandemic, there is no more cancer. So we also have to take care of non-pandemic patients, and countries should probably consider stockpiling, of innovative equipment and supplies. But I think, however, it comes to the fact that the key driver for healthcare system reform and the driver of resilience remains digitization, right? Think about digital technology that makes the management of patients in hospitals more seamless, more efficient. We talked about it, more agile, more flexible, and of course, connected. And digitalization, I think, will kind of scale up the capacity for information exchange about diseases prevalence. So I think this is a great opportunity now as a learning from the actual pandemic to prepare for potential future shocks that I'm afraid will be coming.
Mm-hmm. And from, and this question is open to anybody, do you guys see sufficient investment or sufficient intention on the part of governments to move in this direction? Or is that still not where it needs to be?
I just wanted to respond to the
Oh, unfortunately, Roberta's connection looks a bit weak.
In China. Okay. I just wanted to say that I can. Okay, go ahead. I can hear you. Yeah.
Please continue.
Yes. So the government, I think, so embraced this solution of digitization, and very quickly then changed the regulations regarding internet hospitals. And just during the year of 2020, there were over 700 internet hospitals approved in China. And very quickly after that, the government approved reimbursement of online diagnosis and also pharmaceutical dispensing. So, I see the Chinese government not only investing with their dollars in terms of supporting systems for public health, but also supporting the availability of healthcare in a digital way by allowing for the change in regulations and reimbursement. So, yeah.
Do we see the need for that elsewhere? I think, Andrew, you're going to say something, yes?
Yeah, Rachel, I was just going to add, I mean, I think China is fairly unique in the ability to move boldly and quickly without having, all of the back and forth that traditional or many other markets or countries might face from in terms of how they're organized. I do think, though, Mathias, you mentioned a really important thing. How are we nudging? How are governments? How are we working to nudge people to manage non-communicable diseases in a pandemic situation? Clearly, we need to be prepared for that. And then, as you mentioned, Roberta, how are those reimbursement or those other policy nudges helping to transform those sites of care so that people can execute in that environment and still, not be uncompensated or something of that effect? And probably the third thing that we've seen is the sharing of data. When you think about communicable diseases and awareness of infections in hospitals, the mention about the vaccination card in paper or on the cloud. There are systems now that allow healthcare hospitals across the country. We work with New Zealand to create a whole communicable disease database. So that information is live every day and you can start to see it across the country. So there's a lot of data right now we have. How do we really make it, use it, so that we really can respond quickly in the next situation?
And one of the things that occurs to me is that we need to go onto an international and internation sort of stage, because when you talk about travel again and vaccinations, there's got to be a way that a lot of this data can flow to different countries as well. I mean, does anybody have thoughts around the challenges there or the necessity of doing that?
Yeah, probably like to jump in a little bit on the piece again on how do you harmonize data. I'll be honest, I think as a provider, we've done so many, vaccinations, we've done PCR testings, we've done ART testings, and we're doing tracing requirements. I think what is really lacking, and I'm hoping that somebody could solve this as well, is really how do you harmonize these data sets? As you are required to present those across borders, or even just essential life requirements like going back to school or the office on a workplace safety perspective, right? How do you then present this information? I think the other piece that people may not necessarily see this, but I see there as an issue and upcoming as well, is authentication. How do we know the digital certificates that you get in one country is transferable to another, and how do you recognize that? And so I think there is a role in which we have been engaging two different sets of companies to that provides blockchain technology, and this is something that's driven through the Singapore government, but also the private sector, on looking at authentication of some of those vaccination certificates or even PCR testing. And so that's something that I thought I'll just put it out there for people to comment as well.
Yes.
Any thoughts on the solution there?
Yes. Yeah. So I'm just going to comment here also on how the government will help the population and the citizen within the country. It's not about investing money only. It's about proper foundation for getting the right regulations on the country, the policy and the compliance and the workflow needed across the country. Second, like Margaret mentions about how we can depend, like in Qatar, how we can depend also on the identity and authentication mechanism and system available by the government authentication identification organization in Qatar. Definitely how we can build a sustainable model between the government and the private sector, also as a PPP model. So all this, it is part of the government mandates, because it's not about health issue, it's a public safety issue. So how we can shift our gear from health pandemics issue to the public safety. Plus also introducing, like you mentioned, blockchain, definitely one of the key takeaway, how we can introduce what we call it as a blockchain for vaccine certificates within the country, and how would the government help to explore or to connect to the international blockchain for vaccine certifications. When I take my vaccine on a country, so it will be approved on another country without any limitation, it's like a e-certificates or passport for certificates. Now, your passport on your country will be approved on another country. This is the another angle if government will help and support moving forward. So I will give the floor for anyone because we have a short of time right now. Thanks.
Yeah, unfortunately, it looks like we're totally run out of time, which is unfortunate because I feel like we could have this discussion for another 30 minutes or an hour, in fact.
Yes.
I think we've discussed some very interesting thoughts around, how the world really needs to be moving in this direction. At the same time, a lot of challenges remain, a lot of bottlenecks. And I think really the intention and the investment and maybe the persuasion, in fact, is very necessary. So, I just want to thank again all of our speakers. I mean, please go and look at their bios on the website and please reach out directly to them. I think all of you have so much more to share with people who are interested in this space. And thank you for being generous with your time. And thanks to our viewers. Hopefully there are some out there. And we'll talk again. Thank you.
Thanks so much.
All right.
Thanks everyone. Bye.